a standard when looking at the assessment of rigidity and stress and strain. And that data haven't been provided to come up with them to look at where the plate is behaving in a linear elastic fashion when it's behaving in a plastic fashion. They talk about maximum load in this paper, but there's quite a few articles, and this is a very good review I found in the JBJS, stating that maximal load is less important in orthopedics. There's also been a move towards more outcome-based studies, and that's certainly something to take into consideration when, although the biomechanics are important, ultimately at the end of the day we're treating outcomes, we're not treating these numbers. And this was obviously a single fracture pattern, and one that potentially didn't quite correlate with the AO classification fracture that they were attempting to. So in conclusion, for distal radius fractures, they are very common. There are more than 30 plate models available currently on the market, with very little, as I said, very little evidence. There's a Cochrane review which shows that 42 of the 44 studies found had inadequate blinding and questionable methodology, and there's nothing at all that's level 1. Despite that, there is a trend towards open reduction and internal fixation, and more studies are required to determine the optimal screw number and control for all those other variables, to look at the biomechanics and strength specifically of these different locking mechanisms being introduced. And then these findings need to be tested in clinical trials. Another interesting demographic point with regards to distal radius fractures is that there's quite a binomial distribution, meaning that they occur in either younger population being a high energy injury, or in an elderly population being an insufficiency or osteoporotic fracture. And I would postulate that there could be some different mechanical aspects to both of those, and potentially that needs to be looked at as well when considering plating of these fractures in the most stable constructs. And there's some other further reading that I found useful.